So this date was established back in December. We didn't quite know what we were going to have available to us as of January 29th. We thought maybe we'd have a more complete view of the New York State budget. We do have the executive budget, but we don't have much that we can speak to on the President Biden $1.9 trillion plan. But nonetheless, I just want to start by saying versus where New York State was prior to Election Day in November, the state is in a much better position today, at least from a fiscal perspective, than they could have possibly imagined the day before Election Day. We now have Senator Schumer as the majority leader. We have President Biden as a Democratic president in the White House. We have a one-seat majority for the Democrats in the Senate and about an 11 or 12-seat majority in the House. All of you have been, I'm sure, paying close attention to news media and social media and Google outlets. And obviously, with those thin majorities, the outlook for the future here is going to be still somewhat unsettled. Next slide, please. You can read this and just be aware that we want you to be sure that you do not take what you hear from us today as being gospel, but anything related to your specific facts and circumstances should be reviewed with your independent counsel, legal, accounting, or any other outside consultants that you think would be appropriate. This program is being recorded. The slide deck we hope to get out to all participants on Monday, no later than Tuesday. So for those of you that want a copy of the slide deck, it will be coming to you shortly. Next slide. So very quickly in my 10 minutes or 12 minutes here, the COVID saga continues. I've mentioned that we thought we were going to have more to say today relative to the Biden plan. We do have some things that we can provide, but by all means, it's still unclear as to what Congress is going to do with respect to that $1.9 trillion proposal. The last I read this morning was that they were hoping that there'd be something done by mid-March. We have our next program that we moved from February 12th to March 5th. So I believe that March 5th date will be appropriate for reviewing the status of the Biden American Rescue Plan. So we are also reducing our session today to 2 hours. We had some feedback from folks related to 2 hours versus 3 hours. If you do have occasion to give us some feedback, for those of you that are interested in either a 2 hour or 3 hour session, we would like to get a little bit more information from you in terms of the length of the sessions we provide. And we realize that we are all suffering from webinar fatigue here, so we'll try and make this as, if you will, as interesting and move it along as quickly as possible for purposes of getting the information necessary to you. Next slide. The agenda, as I mentioned the speakers earlier, it is my objective to give you some perspective on questions that you may want to ask, some of which we can answer, some of which we cannot, and then you'll see the remaining items there listed. Pretty comprehensive, if you will, in terms of current issues facing health and human service providers in the New York State arena. We want you to ask questions, so the chat function, again, all panelists, is the way we want you to go. And if there are questions, you should feel free to put those into the chat, and we will either at the end of the session or during certain of the presenters pose some of those questions so that we can answer them during the presentation. Next slide. Next slide. So, open questions to be answered. As you should all know, January 19th, even though Governor Cuomo said on December 16th that he was not going to provide a budget until he knew whether he was getting $15 billion to close a budget hole, he went ahead and presented an executive budget on January 19th, when he had earlier said in December that he wasn't going to do anything until February or March, when he knew about his additional federal stimulus. That may have been prompted by the fact that on January 11th, Comptroller DiNapoli reported that the budget shortfall for this New York State fiscal year, in his view, is not $15 billion, but actually somewhere between 0 and $4 billion. We do not have an answer to the question of how did this happen, other than government does operate on the cash basis of accounting. So if they don't pay bills by the end of March, you can have a direct bottom line benefit from the standpoint of your deficit by deferring payments from March into April. All of you know they've done that in the past with the Medicaid lag and delaying claims payments, etc. The Biden Rescue Plan, known as American Rescue Plan, has potentially allocated $350 billion for state, county, and local municipality supports. As you know, up through December, early January, Governor Cuomo was asking for a $60 billion relief package for New York, $20 billion for this year, $20 billion for next year, and $20 billion for 23. Highly unlikely that if $350 billion is out there for all 50 states, that we are going to receive $60 billion. The last bullet here I think is important because it keeps bouncing back and forth. I had heard after Biden's proposal that they put the $15 federal minimum wage in as a potential throwaway in the negotiating process. Then I heard earlier today that they are more intent on adjusting the federal minimum wage. Obviously, $7.25 is not something that anybody can live on today. It has not been increased since 2009. Next. So the main item that we're going to cover in several of the presentations that follow, the $900 billion COVID relief bill that was signed by President Trump on the 27th. It is something that has created, again, further confusion. We have in these slides the original PPP, OPPP designation, and we also have PPP1, which are those Paycheck Protection Program loans that were received in 2020. That will be number one. And number two will be those that were authorized under the $900 billion plan. We also have some extensive discussion on the employee retention credit. Again, mass confusion for many of you because you are now being made eligible for the employee retention credit even if you got a PPP in 2020, but it is a very complex set of regulations and requirements, and we'll have Mike Vollmer cover that. But it is so complicated. Again, we've said this in previous presentations. We want you to reach out to your own advisors. We want you to reach out to us with questions you may have, etc. The Majority Leader, Senator Schumer, has been on several calls over the course of the last week, and his general message has been that he believes that New York is in a very, very favorable position with respect to the Democratic control of the presidency, the Senate, and the House. How much that will come to bear with such slim margins is going to be yet to be seen, and hopefully we will see something over the next 45 days in terms of progress and more clarity on that Biden proposal. However, as I said, not only are we better off than we were the day before Election Day, but the Georgia runoff elections obviously shifted control of the Senate. The key provisions of Governor Cuomo's executive budget proposal, we know that there are many, many different sources for you to gain and obtain information. We've provided a significant number of web links here that you can access. This one you may want to take a picture of if you want to be in a position to have the ability to access these links before we send out the slide deck. And the last bullet here, make sure that everybody knows there are many, many more websites, including our own, that provide information on a regular basis, but we still are in a 24-hour news cycle with respect to both the New York State and federal budget situation. Next slide. The key provisions, which are subject to 60 days of legislative hearings, debate, and negotiation. The final version of the American Rescue Plan will have a direct impact on how the budget gets adopted. Last 2 years, I think it was adopted on March 31. So we're going to go right up to the 11th hour, 59th minute on the New York State budget. And if, in fact, we do get indication that there's $15 billion coming from the American Rescue Plan to New York, I think some of what I'm about ready to describe to you is going to be relieved or made more beneficial, if you will, to the providers that are represented on the phone. I've been around now for 47 years. I am astounded that we are now at $83 billion for purposes of the Medicaid program for the next fiscal year starting on April 1. $48 billion, or approximately 58%, is paid by the federal government. So you know whenever you're dealing with Medicaid, even though it's a New York State-run program, it has the funds involved from both the state and the federal government. Governor Cuomo has included in his budget a 1% across-the-board reduction in Medicaid payments, essentially across all program service areas to be effective July 1. There has been some discussion that it could be 2% if he doesn't get the $15 billion that he's expecting. Could be that we don't need to do an across-the-board cut if he does get the full $15 billion. The Medicaid global cap that applies primarily to hospitals, nursing homes, facility-based clinic providers has been extended through March of 2023, so 2 years hence, and the rate of increase in the global cap has been limited to just under 3%. More importantly, for those of you that are in rate-based fee-for-service programs, whether you're protected in your managed care program codes or whether you're in straight fee-for-service, the no Medicaid trend factor is proposed to be extended through March of 23 as well. So you're being once again asked to do more with a more complicated population, an aging population in Medicaid, more individuals covered by Medicaid with effectively less dollars if you agree that there are certain aspects of the economy that are inflationary, and certainly health insurance premiums would be one of those areas. We may see some big spike in gas prices as a result of the climate change initiative that Biden put forward yesterday. Then again, I put the last one in just to show that there is significant opportunity for shifting to a cash basis of accounting where we might end up for the year ended March 31, but we are proposing, or he is proposing, all of the 2-week Medicaid lag for achieving $150 million of cash basis savings, pushing those claims into 2022. All right, the other areas that I think are important to most everybody on the phone, and these are significant. We've been talking for the last year about how the DSRIP program was basically dead and gone, how it was in February rejected as to the extension that was provided by the Department of Health to the Trump administration. We now look as though we are going to get potentially a 3-year extension. It will not be an $8 billion program as the initial 5 years, but it is certainly a major plus from our perspective in terms of the ability to continue the initiatives that have been conducted throughout the state and the 25 performing provider systems that had responsibility under the initial 5-year DSRIP program. It does carve out pharmacy services, and it does implement a broker model for non-emergency medical transportation. The funding focus continues in DSRIP on value-based payments, telehealth, workforce, health equity, and support for social determinant of health providers. I think, again, this behooves all providers, as the Biden plan gets enacted, to reconnect with whoever in your particular region is going to be managing the extension of DSRIP for whatever period of time it's been awarded, whether it be 1 year, or whether it be for a full 3 year. There is an allocation for DOH-funded providers for $2 billion to cover minimum wage increases for Medicaid-funded services. Vital access providers, which are essentially mostly nursing homes, some hospitals, $132 million to take care of those very distressed situations where VAP grants can avoid bankruptcy, defaults on debt, etc. And you see the limitations there: nursing home care hospitals, and clinics, primarily funded through DOH. And then the program for the statewide healthcare facility transformation has a $425 million allocation in the budget. So the Dormitory Authority, I'm going to finish up here hopefully quickly. It was formed in 1944 to build dormitories for the returning war veterans. And now we're up to $17.4 billion of authorized bonding for DASNY. DASNY has never had a default, and it's important for you to know that. And there's an additional $5 million in the budget for nonprofits for design and construction services. Extensive expansion of the scope and funding of telehealth services. I think I said last month that the COVID-19 pandemic has accelerated the implementation of telehealth by a period of 10 years. And all of you are going to need to be sure that you have not only the sophistication, the equipment, but the clinicians to be able to effectively keep pace with that 10-year acceleration. The mandatory paid leave for 4 hours for COVID-19 vaccination, that's 2 hours for each vaccination dose. That's what we frequently refer to as an unfunded mandate, and the unfunded mandates will continue as they have for mostly the better part of the last 10 years. And then the last two bullets, significant emphasis on increasing the number of nurses that are available in the system for purposes of the next 10 years. I don't believe that we can wait 10 years for 40,000 new nurses. As I've said to you before, the baby boom generation, which ended in births in 1964, that generation, of which I'm a proud member, is retiring approximately 10,000 people a day in the U.S. each and every day. So when you look at the number of new jobs that are created on a monthly basis, which has been rather paltry the last 4 to 5 months, consider that roughly 300,000 people are retiring each and every month for the next 7 to 8 years. Next slide. A lot of you are going to want to know about where we are with managed care, particularly in the IDD sector. Just be understanding that there is a proposal out there relative to the CCOs, which recently were notified of a substantial rate decrease. Commissioner Kastner on the IDD side is focused on moving forward with a medical-only model for voluntary enrollment in 22 and potentially mandatory enrollment in 23. I think all those dates get moved out as we continue to solve the pandemic, and it doesn't look as though we're going to be through this process until late summer or early fall, given the vaccine issues that have arisen and the variants of the coronavirus that are popping up around the world. I do think it's interesting that with the pandemic that there's $45 million of savings projected in the budget through a reduction in home care and workforce and recruitment and retention funding. I assume that's because the state feels that there's been plenty of stimulus money provided by the federal government so that they can afford to remove some of the state dollars. Many additional provisions, but not worthy of discussion today because it is important for us to recognize that we've got 60 to 75 days of debate that'll go on relative to Governor Cuomo's budget. But again, the main message that I have for you is that it is a very, very confusing environment still, and will remain confusing, and does require each and every provider to seek out assistance from outside advisors. We have a polling question, I believe.
Yes, we do. So for those needing CPE, we'll need you to respond. If passed, the American Rescue Plan, based on what you know today, will have the following impact on your organization. Very negative, somewhat negative, no impact, somewhat positive, and very positive. So the poll is open. You have approximately about a minute and a half to respond.
While you're answering that question, I will just give you my final slide. I'll finish up here in what looks like 22 minutes, not too bad for me. You can be assured that OMIG is going to increase their recruitment activities. You can also be assured that the OPRA providers that were the pilot for OMIG to look at certain, if you will, claim submissions for 32 providers around the state, right now has created a substantial disruption in terms of the amount of monies that are being requested back. Just be aware that there's negotiations and possible legislative intervention or litigation that is going to have to take place. If they continue down the path that they are on these OPRA audits, it will completely collapse and implode most of the behavioral health providers, at least the community-based providers in the state of New York, given what they are applying as what I consider to be a technical violation of the submission of a claim. I talked to you about the IDD managed care arena. As we said the last couple of webinars, recreational marijuana is now front and center. You know we have it already in Massachusetts, so it's only a matter of time. He has established the Office of Cannabis Management. Those of us that grew up in the 60s and 70s could never have anticipated a New York State Office of Cannabis Management. Not that I was partaking, by the way. So budget hearings are scheduled for next week, February 3rd and February 2nd, you see. And I would encourage everyone to continue through your provider associations, advocacy. And there are many provisions in this budget that, depending upon what happens with additional stimulus from the federal Biden plan, will have us being on a roller coaster ride for the next 60 to 70 days through the end of March. I'll stop there. Again, ask if you do have questions, please submit them. At this point, I'd like to turn it over to my colleague, partner, John Miller, for his presentation.
All right. I will, over the next 15 minutes, be piggybacking off of Jerry and discussing the Biden American Rescue Plan. Before we get started, I think it's important to note some of the poll results that came in. Of those that answered, approximately 70% of you believe that the American Rescue Plan will be positive on your organization. So some felt the number one response was mainly somewhat positive. So I'll walk you through what's in there and what I've read thus far. So obviously the disclaimer to get these slides to marketing and get it here today. It is what we knew as of January 25th. Obviously, that's changed this week, and it will continue to evolve and change. But so just take note of that's what I know today. So some of the important facts Jerry did mention on January 14th. Prior to taking office as an inauguration to hit the ground running, Joe Biden released his $1.9 trillion emergency stimulus plan. The focus is to really fight the pandemic war on two fronts: the medical piece of it and then the economic impact. There were items in there that some can say, how does this relate to actually either of those, medical or economic? Jerry talked about the $15 minimum wage, and there's also another example, funding to improve cybersecurity. Jerry mentioned, and I think this is a good point to note, that in theory, these proposals will have to go through legislation, through congressional legislation, to actually pass and become law. We saw that with the previous CARES Act, and then the CSSRA went through legislation, which ended up in months, the second one, months of negotiation. So as Jerry said, it will be a roller coaster ride on how this passes and how it gets through. So what's in it? Jerry mentioned, and I think all of us have focused on, those that have watched the governor speak over the past 10 months at his daily press conferences, the $350 billion in emergency funding. The takeaway from this, when I look at the takeaway from this, when I read what's actually in this plan, is it's not just going to be a slush fund saying, here you go, local, state, government, here's the money to balance your budget. There are what I'll call somewhat restrictions, obviously to replace the revenues that the governments have lost. So your income tax revenue from lower income taxes, sales tax revenue because people are buying less. But also funding is going to keep the frontline public workers on the job and paid, and in addition distribute vaccines, scale testing, reopen schools safely, and maintain other vital services. Another piece in his plan is reinstatement of the requirement from the Families First Coronavirus Response Act. That's emergency family leave. For those that recall, the Family First Coronavirus Response Act, that was actually the first one that came out in terms of a stimulus and COVID relief. That came out mid-last March. That was before the CARES Act. This is saying $1,400 a week, and it's going to eliminate some of the loopholes for employers with below 50 people. And we've heard about the small business fund, most notably a $15 billion grant program to small businesses. Almost like a third PPP. I'll talk about that in a moment. What else is in it? I mentioned earlier $10 billion in cybersecurity. Before you get excited and think this money is going to flow to you, this is actually intended for the federal government to help them build up their cybersecurity infrastructure and respond to the risk that we're seeing. Extending eviction moratorium up through September 30th, 2021, and financial assistance for renters and secure housing for homeless. And $130 billion to reopen school. This week, I think we've seen a lot of political theater on this $130 billion with a lot of talking points and strategic leaks. But really to get the reduce the class size, improve ventilation equipment, PPE, and custodial, close the digital divide that I'm a big proponent of, and creating and expanding community schools. In addition, you see another $5 billion allocated to states to help with schools in education programs impacted by COVID, and $35 billion in higher education funding to community colleges and historically black colleges. Continuing on, the first bullet, this is the question I get every other day at home, where's my check? So I put this in here, though it might not impact your business, but if you were to look up the Biden Rescue Plan, you will see the main discussion is the $1,400 direct financial assistance. Obviously, there's household size and income thresholds. Another one in this plan is supplemental unemployment compensation. So they're extending the unemployment compensation. They're actually offering this to the gig economy. That's your Uber and Lyft drivers, your Grubhub, and also as well as your independent contractors, and looking at a $400 weekly supplement. New OSHA standards to cover COVID-19 protection standards. Part of my takeaway on this is one, to make sure how you're complying, what you need to do to comply. And really, do you know if you are in compliance? Because a lot of standards have come out over the last 10 months. And as Jerry talked about, $15 minimum wage, this bill came out, I believe I saw it on Wednesday. It was the 4 members of Congress proposed the Raise the Wage Act. I'll talk about that in a second. The legislative process, Jerry alluded to it, but it's a good reminder. Right now, the House of Representatives has 221 Democrats to 211 Republicans. There are 3 vacancies. At this time right now, the Senate's 50-50. Vice President Kamala Harris has the deciding vote. In order to get legislation through, the Senate technically needs 60 votes. Again, we've seen some items come out about the filibuster this week and what would occur. But what you can do is you can actually take this bill and you can put it through the budget reconciliation process, which only really requires a simple majority. Jerry said, it's going to be a roller coaster ride, how it's going to occur, because those slim margins, doesn't take much for 4 or 5 people to say, hey, I'm not supportive of this, and I'm going to vote with the other team. I think the other takeaway as we watch this is actually President Biden and Mitch McConnell. They served in the Senate a long time together. From what I've read, is they're actually friends, and they both respect the institution of the Senate. So again, how does this bill get rolled out to us? And then we have polling question number 2 that I am going to launch. How often does someone, I already said this, how often does someone in your household ask you if you're getting $2,000 from Joe Biden? A, 1-2 times a week, B, 3 or 4, C, daily, or D, not at all. So I'll open that up and let those needing CPE respond to that, and I will continue on. So as I just laid out some of what is in the bill, in the proposed legislation, some things to think about if this is passed and what the strategy and considerations are. Jerry did a very good job on laying it out from the New York State perspective, but I'll reiterate it. The only certainty right now is uncertainty. So really the governor has said he's got two plans. He's got the worst case scenario plan and the fair funding scenario plan. Obviously, though, the worst case scenario is they believe we would only receive $6 billion. So what would occur under there is a restoration of the 50% of the 20% they've been holding back to you, holding from you since July. So essentially that would be a 5% cut where we're going to tax the rich with the increase in taxes for the wealthy. There's going to be across-the-board cuts to social services, $600 million cut in Medicaid, and $6 billion reduction in school funding. Under the fair funding scenario, they'll restore those 5% cuts that I mentioned earlier. They'll implement scheduled middle tax cuts. They'll fund education, and then they will provide the necessary funding to the 1.6 million individuals added to the Medicaid rolls since 2012. So one is very draconian, and one is very rainbows and butterflies. Probably will end up in the middle. We'll end up in the middle. Then, apologize as I am working through the polls. Other item to consider is labor. As you're very well aware, mainly in human service and health and human service providers, 70% of your budget relates to your labor, whether it's salaries and wages and benefits. And you've really struggled with turning over and filling vacant positions. We've had some conversations. I've heard as high as 30% at a human service provider with vacant positions. Another item that stuck out to us is we were talking recently with a human service provider, and they said if you took away the senior leadership team, they believe only 5% of their workforce has been there for over 2 years. So think about that cost related to recruit and retain your workforce. So increased compensation. We've heard about the increase in the federal minimum wage. I know this slide might be getting a little bit smaller for you as we work through the bullets. What this essentially would do is this would align the federal minimum wage with what current New York State law is. The speculation, it passed, well actually that got updated when they came out with the Raise the Wage Act. So if passed, this is going to be phased in through 2025. I think it's going to end up being consistent with what New York State law is. Right now, New York State law has at least $12.50 in that current minimum wage, and then based on your industry and your region, then your minimum wage is set there. But really, the goal is to get in New York State is to get your minimum wage to $15 an hour. So as you're very well the considerations that we've been talking about over the last 5 to 10 years related to New York State minimum wage, it's going to raise up the wages of your lowest paid employers. Is that going to have a compression on the other employees? Jerry mentioned, is this an unfunded mandate? So where's the funding going to come for this, especially if you look and say, hey, we're going to have Medicaid cuts. And then also competition from your competitors in the industry and outside the industry. If I can be doing something that's less skillful for $15 an hour, am I going to do that there, or am I going to do that at your agency? Also, related to labor, tightening of the labor market. Jerry talked about, I think the 10,000 baby boomers are retiring a day, but we're looking to extend unemployment benefits. Yes, that's good for those folks that need it, but think about the impact to your agency and what's in the labor pool. One of them in the proposed legislation, 100,000 jobs to perform vaccine outreach and contact tracing. I think when I saw that, I texted Jerry and said, where are they going to come from? Because we all know what the labor market is right now for our current clients. Where is this 100,000 employees going to come from? And I talked about earlier the extension of the Family First Coronavirus Act. So again, tightening the labor market, what's that going to impact you to recruit, retain? And I think this one is good too. Do you have the right people with the right skills, knowledge, and experience providing the frontline service, directing the people providing the frontline service, and making decisions? And that just comes with experience and turnover at your agency. Then also aid to business, $15 billion in grants to small businesses. This is going to build on the second round of the PPP that came out that Mike Vollmer is going to be discussing. An investment in $35 billion into state, local, tribal, and nonprofit small business financing programs, and an additional $175 billion in lending to small business. So right now, as we know today, we don't really know what eligibility is. We can look at what they've outlined in the PPP that looks smaller and more restrictive than previous rounds. But kind of also, as you look at your agency, how has the pandemic impacted your operations? How has it impacted your mission? Maybe you start looking and thinking about this financing to say, what do I need to invest back into my plant infrastructure on the other side of this pandemic to continue to be successful? So right now, we have questions up. Jerry, do we want to take a moment? Because some questions have come in the chat.
Sure.
All right.
Take two.
Take two. We're going to take one that actually came in earlier today, and I think relates to this. Let me switch back to it. Jerry, this question I think is good for you. How budget impacts healthcare, and with the cuts, 20% of withholds services are going to be lost, and you're going to be under pressure, as well as mental health needs of whether it's your employees or society as a whole. And now we're seeing the rise in overdose deaths. I think it's less of a question, more of a statement, but more of what the human service providers are facing. In your 46 years of experience, do you have any wisdom to respond to that?
Yeah, we could spend an hour on this statement by itself, but just my position, as I said in one of the slides, is that we're going to have legislative intervention, litigation. If we go to the point of not getting the $15 billion, and we do have reductions in the behavioral health arena, it is going to be something that has to be, relief has to be provided, whether it's at the state level or the federal level. I think the environment right now is obviously very, very stressed at this point because of all the things that you've mentioned. But I do believe that we'll have a better picture of just what will happen come March, and that's where I believe we're hopefully going to see some more logic and rational thought applied, because in the middle of a pandemic, with what you've described as mental health issues expanding and the increased demand, it is counterintuitive to be cutting funding in that kind of an environment. It would be kind of like somebody saying, well, let's not buy another 200 million doses of vaccine because we don't have the money for it. It's basically analogous to that, and I don't think that's going to play well in either state legislature or in the federal Congress.
And I'll take the second one, which should be a shorter answer, is any indication on how much the New York State Medicaid enrollment has increased during the pandemic? We looked at some county-level data that gets reported through the state website, I think, a couple months ago, and we saw a 10% increase. So 600,000 people have joined the Medicaid rolls in New York State since the beginning of the pandemic. And that piggybacks to what the first question was, is how is it all going to be funded, especially if we're facing cuts? So with that, we're going to turn it over to Margaret Lely to talk to us about the Provider Relief Fund program.
Hello. I'm not going to go through the whole spiel because I'm sure everyone is a little bit familiar with the Provider Relief Fund at this point. If you're not, certainly reach out and ask. But what I'm going to talk about today is the changes in the reporting and the that came about because of the legislation that was passed in late December. So the Coronavirus Response and Relief Supplementary Appropriations Act was passed in late December, and then all of the items related to the Provider Relief Fund were then kind of put into the reporting documentation that was released on January 15th. And then at the end, I'm also going to talk a little bit about the reporting portal that was supposed to open on the 15th. So obviously the legislation supersedes all of the previous guidance, and it did a lot of great things for the Provider Relief Fund. So the first thing is it provides you with a lot more flexibility in how you use the funding. So one of the big items that came in the legislation was the change to the lost revenue calculation. Now, for anyone who's been following this over time, you know that this calculation has changed several times. At one point, it was limited to net income. And this legislation really kind of takes it back to the very beginning, where they're very flexible on how you're allowed to calculate it. So you can use your actual 2019 patient care revenue compared to your 2020 patient care revenue, or you can now use budget. So this is really great for providers who maybe had a change in service line. Maybe they added a service or dropped a service. And so their 2019 and 2020 revenues weren't really comparable, even regardless of the coronavirus. The only caveat to using this method is that your budget has to have been approved by March 27th, which makes sense. You know, they want you to have had a budget before the original COVID relief fund bill was passed, so that you're not kind of gaming the system and driving up your budgeted numbers just to increase your lost revenue. The other allowable method for lost revenue is what they call any reasonable method. So this really kind of opens it up, again, provides flexibility to providers that are in kind of, you know, really different situations. And again, if you do choose to use this method, you are going to have to provide a written explanation of your methodology, kind of describe why it's reasonable, and describe that method really captures the effect of coronavirus and not some other outside source. So the other area of flexibility in the law is that you're allowed now to move targeted distributions around subsidiaries if you have them. So if you're part of a big group and one subsidiary had a lot more losses related to coronavirus than another one, you really can move any of the money now. Prior to the bill, you could only move the general distributions, and now you can move that targeted money as well. So this would be targeted nursing home distributions. They had some targeted distributions for rural health clinics, for you know, highly impacted hospitals, that kind of thing. The only caveat to this is that if you do intend to move targeted money around, the entity that originally received that money will still have to report on it and report that transfer. And transfers of targeted distributions are going to be scrutinized more heavily, and there's an increased risk of an actual HRSA audit in that case. And this makes sense because, you know, they gave the money to certain targeted groups because the need was demonstrated, and so if they didn't need it, they really kind of want to know why. So the other big piece of this legislation is that there is more money coming. I'm kind of calling this a phase 4. It hasn't been formally announced yet, but the legislation provides that of the approximately $38 to $43 billion that are left in the Provider Relief Fund, of that, $3 billion was newly appropriated in this bill. 85% of that, so $32 billion to $37 billion, has been earmarked for this phase 4 distribution. Now, any of you who applied for phase 3 know that there was an add-on payment that was possible based on your losses in the first 2 quarters of 2020 as they compare to 2019. So they really wanted to kind of give extra money to providers that were hurt the hardest, and it was that add-on payment was supposed to make you whole for up to 88% of your losses over that time frame. So this phase 4 is kind of the same scenario, but this time they're looking at losses for the 3rd and 4th quarter of 2020 and the 1st quarter of 2021. Now, we're not exactly sure how this application process is going to work, and it could be that it's kind of included in your reporting for 2020 because the way that the reporting portal works, they would have the information that they would need for this phase 4 from that portal. So just another reason to really make sure that when you're gathering your data for reporting, that you're really being complete about all of your unreimbursed expenses and all of your lost revenue, because we never know exactly what they're going to use that information for. So as long as you have it all listed, you can be sure that if they do intend to use it for this phase 4, you've got your bases covered and you're going to maximize any kind of reimbursement that's available. There will be 15% remaining at the end of this, and they haven't really announced what that's for yet. So I would imagine perhaps more targeted distributions are to come. Now we've got polling question number 3, so I will turn that over to John.
Have you received any provider relief funds? A, yes. B, no. What is provider relief?
And I guess I'll keep going here. So as these new items from the congressional package were kind of put into the reporting requirements, HHS released an updated post-payment reporting requirement PDF on January 15th, 2021. And that's right on the website, so you can certainly go out and check it. And this, believe it or not, is the 5th iteration of these reporting requirements. So that definitely gives you an idea of how often this sort of thing has been changing. And the one thing that we have found with these new reporting requirements is there is more confusion. So one of the big changes from the previous version to this new version is on allowable expenses. You may remember that in the original reporting requirement document, there was a footnote that said that you could use expenses that were required to maintain healthcare delivery capacity, which includes operating and maintaining facilities. So most people took a look at that and said, wow, that's really expansive. I think most providers would argue that almost all of their operating costs maintain healthcare delivery. So this really made a lot of people think that you could really use that money for anything. This language has been removed from the reporting requirements, and the new footnote says expenses attributable to coronavirus may be incurred in both direct patient care and overhead activities related to preventing, preparing for, and responding to coronavirus. So this kind of goes back to, last webinar we had where we advise everyone to kind of look back at those terms and conditions, because those are the things that really haven't changed. And this kind of builds on that. So they really do seem to be honing in more on the incremental expenses that you incurred related to coronavirus that would not have been there in a non-COVID year. And this kind of makes sense because, they went from a very narrow lost revenue definition to now a more expansive one. And I think in response to that, they're now going from a more expansive expense definition to now honing in more on just the ones that are related to coronavirus directly. Another piece of confusion, we've seen some movement in the reporting requirements and the FAQ in terms of lost revenue and how grant funding and specifically PPP will be treated. So initially, the definition of lost revenue explicitly excluded grant funding. In December, I think it was one FAQ that was added, a lot of times they'll add them in batches. So you have big news on FAQ. This one was kind of flipped in where there weren't a lot of new ones that day, and it defined grant funding, said that you had to include it in your lost revenue calculation if those grant funds contribute to funding patient care services. So this is a really new definition, and it really throws into question whether PPP revenue is going to be needed to be included in this lost revenue calculation. Another thing where this kind of changed is PPP is included in the reporting requirements in a section called Other Assistance Received. And this section used to be included up in the lost revenue portion of the reporting requirements. This has now been moved down to the additional data section. So we're not really sure if that means that you do have to include it in lost revenue or you don't. And then, confusing all of this even more is the fact that, what does receiving the money mean? Is it when I recognize it as revenue? In which case that may not happen until after forgiveness has been established. Or maybe it's when you actually got the cash in hand. So these are things that are obviously going to have a huge impact on what your lost revenue calculation is. And we're going to just have to wait for more guidance on that to come. So the other big thing that happened on January 15th is the reporting portal. We've been waiting for this reporting portal since, August, and it was supposed to come out on January 15th, and it did come out, but it's not open for reporting. It's only open for registration. And my feeling is that, they've been hyping this deadline for a long time, and I think they wanted to get something out there. So they have noted that reporting is delayed. So it's not going to be due on February 15th like we had originally thought, but they have not yet announced when it is going to be due. So a lot of uncertainty around this, and we still don't know what the report is going to look like. HRSA has said that they are going to be having webinars. They had originally announced that, and they are committing to still following through with those. So I would, keep checking the website, keep reaching out to your consultants and accountants, and as soon as we know more information, we'll certainly put it out there. What you can do right now is register. So I've provided the website for the registration portal. Now you're going to have to do a separate registration for each reporting entity. And that registration should take about 20 minutes per entity. It's important to note that you have to complete it in one session. You can't save and return later, so make sure that you have all of your documents that you're going to need on hand so that you can complete it in one try. You also want to make sure that all of your data is correct. You will not be able to change anything once you've submitted it. And I would say that probably one of the most important items to get correct and just triple check is the contact email that you're going to provide, because all communication from HHS is going to flow to that person. And, we have had clients before who maybe typed it in wrong, and then they're really losing out on important updates from HHS. So here I've provided the information that you're going to need to register. One kind of confusing item that has come up from people who have registered is that you're going to have to pick a unique username and password for each entity. And they're requiring that username to be an email, which can be really difficult if you have one person that you want to be in charge of reporting for multiple entities. So you do have to have a unique email as a username. But again, I would if you have a point person for all of your entities, make sure that that email is the contact email. That email can be duplicated across entities. And so if you do have that point person, you want to make sure that they're getting all of the updates related to all of your entities. So pretty simple information. You're going to need your tax ID number, your business name, and that contact information that we talked about, as well as the tax IDs of any subsidiaries that parent entity is reporting on. You also need payment information for any one HHS payment you received. And this is so that they can kind of match the registrants to the payments that they have on file. So I've provided there the information that you'll need on that payment. And like I said, the registration probably takes 20 minutes, pretty simple process. Certainly if you have any questions, feel free to reach out. And we'll be accepting any questions that you have through the chat function.
All right, Margaret, we'll do a couple of questions that came in for you. For lost revenue calculation, do you need to include the provider relief funds received in 2020 revenue?
That's another one that we're not 100% sure of. I would say no, because they're looking at how much revenue you lost to justify the funds that you're getting. So the HHS funds are intended to make up for that lost revenue, so it would be double counting if you included them in the calculation.
My guess is this is a question 75% of the people on this webinar have. Is it reasonable not to have had a response from HHS for an application for provider relief funds submitted in the August timeframe?
We have heard of that. I would continue to reach out. There's a provider support line you can call, and I do know that they have made special accommodations to providers in this situation. I think a lot of times it has to do with tax ID verification and validation. Anytime they're trying to put out a big program that fits multiple different types of situations and providers, they're going to run into difficulties. It's very easy for them to deal with hospitals and nursing homes and providers that CMS is used to dealing with. But some of these other types of providers, they do want to get money out. I know that they extended deadlines, but I would keep in constant communication. I do know that if you applied for phase 2 and had not heard back by the time that phase 3 opened, they were kind of voiding out all of the phase 2 applications and asking you to reapply for phase 3. So if you didn't hit that deadline either, we do know that this phase 4 is coming. And I think that under phase 3, they did provide an opportunity for any provider that had not received this payment of 2% of revenue to get that. So I would hope that something similar would also happen with the phase 4, because I do think their intention is to get that 2% out. They understand that it's going to take a little bit longer for some types of providers.
All right, more questions did come in, but we'll keep the program moving. So we'll be turning over to Mike Volmer to talk to us about original PPP, PPP2, and other changes.
Oh, do we have a polling question again?
Oh, polling question. Apologies. Let me get back there.
Right as I was ready to go.
You gotta do a reset.
We're at 4. All right. Are you ready for provider relief fund reporting? A, yes. B, sort of. C, I thought about it, done a little bit to prepare. And D, we have to report on provider relief funds. I hope there is not a D. So that question's open, but Mike, you can get going while that's responded to.
Thank you, John. So as you can see, this was prepared by Jeff Paley, and I am presenting. So if any of you ever talk to him, hopefully you tell him I did a great job with this material. I'm sure many of you have heard many of these things before, so I will try not to rehash things too much. This right here, while you probably can't see it very well, I know, is one of these things that I think maybe you print it out, hang it up on your office wall. It kind of gives you a little bit of a cheat sheet, I'd call it, as far as some of the information for all of these different funding opportunities that are out there. Probably not all, but a good number of them at least.
Give it to their board leadership.
And as Jerry mentioned, give it to your boards. Let them see this, print it out, post it all over the office. So original PPP loans, I like to refer to them as PPP1. You'll see it as OPPP in here as well. Your eligibility, this is kind of old news. Nothing has changed. It was if you had less than 500 employees, there was some other specific qualifications with additional employees if you were under certain industry codes. You do have to look at this on an affiliated basis. So you had to have less than 500 employees with all of your affiliates. The definition of affiliate here is different than in virtually everywhere else. The SBA has its own affiliate definition. As we'll talk about later a little bit, the employee retention credit is under IRS regulations, has a different affiliation definition. Affiliation as far as financial statements is different. So all of these different calculations of what affiliates are or definitions of what affiliates are. So you are in any way under the control or affiliated with a governmental organization, you are not eligible. And if you were anything but a 501c3, 6, or 19, you were not eligible originally. As far as forgiveness goes, almost every lender that I've heard of at this point is accepting applications for forgiveness. There is one southern tier lender that I've heard is still not opened up yet. I'm not going to name them, but if any of you have your loans with them, you would probably know that right now. The calculation, the most important piece of the forgiveness is, did you spend the money on the eligible expenses, the eligible costs? What were you allowed to spend it on, and did you spend it on that? The law that was signed in the end of December did open up the eligible expenses, the eligible costs to include a few more things that we'll talk about a little later. The second most, I think, important question as far as forgiveness or important item is your FTEs. So did you maintain your FTE levels as they were pre-COVID? Or did those decrease? If they decreased, you may end up with a reduction in your forgiveness amount. However, they did build in a couple of safe harbors related to that. If you were shut down due to governmental order and you weren't able to restore your FTEs because of that reason, or if you did have a reduction, but by the time you applied for forgiveness, or by December 31st of 2020, the earlier of those two dates, which probably nearly everyone has not filed for forgiveness. I'm sure there's a few that have. So if by 12/31/20 you had restored your FTE levels to the pre-COVID numbers, then you could be eligible for this safe harbor. Some other common questions, complications. Did you reduce anybody's hours or pay rate by more than 25%? The hours factors into the FTE. The rate factors into a salary/rate or salary/hourly rate reduction. So it doesn't necessarily care if people earning over $100,000 a year had a reduction of 25% or more, but those underneath $125,000 a year, if you reduce their salaries by more than 25%, then you will be facing a reduction in your forgiveness amount. Did you try and hire people back to positions, but you couldn't? Either they didn't want to come back, they weren't able to come back for some reason. Did anyone leave for any non-COVID reasons that could affect your FTE reduction potentially? And there's, again, some safe harbors related to some of these things. If you fired folks with cause, if people quit, or if you offered their position back and they refused, there's safe harbors built in for those situations as well. So the eligible expenditures, originally they described as payroll, including health, dental, vision benefits, utilities, rent, and mortgage interest. There is the new eligible expenditures that are retroactive back to PPP-1, as well as going forward with PPP-2. And some of those are essentially software that supports your operating and administrative functions. The way it's written, it seems to be related to COVID. If you're in an area that you experienced damage related to some of the turmoil over the summer, you can use those costs that were not covered by insurance in your PPP. The cost of goods that are essential to the operation of the entity, kind of a broad open playing field in some ways for what you could call those. And essentially PPE. So if you didn't receive any other funding for PPE and you're looking for somewhere to help cover some of those costs, you can use your PPP loan to cover some of those costs and receive forgiveness. The loan necessity questionnaire, I know there's been a lot of questions and a lot of worry around these loan necessity questionnaires. 3509 is for a for-profit business. 3510 is what those of you that are attending today would be using if your loan was over $2 million or your cumulative loans for your affiliated group were over $2 million. A lot of people are concerned about what's the SBA using this information for. They're using it to try and assess your representation when you took out that loan, that current economic uncertainty made that loan request necessary to support your ongoing operations. So if you recall, when you applied for your PPP loans, and if and when you apply for a PPP-2 loan, there's a certain number of attestations that you have to essentially initial off and sign off on. And one of those is that, again, economic uncertainty makes that loan necessary. So they're kind of trying to assess that you made that assertion in good faith. Now, is it clear how that's going to play into the future review and audit of these loans? Not really. They haven't really told anybody too much about exactly how or what they're doing with these, other than the fact that once your lender tells you they need it, you've got 10 days to get it back to them. I'll turn it to John for a moment for another polling question.
Ooh. Right. Polling, where did it go? I'm gone. My organization's involvement with the Paycheck Protection Program is best described as A, we have an original PPP loan and the forgiveness process complete. B, we have an original PPP loan but have not applied for forgiveness. C, we have an original PPP. Well, that's the same, so B and C are the same. And D, what is the Paycheck Protection Program? All right, that poll is launched.
Thanks, John. This gets into a little bit of the accounting behind the PPP loans and what you may and may not do. And the guidance has been a little bit loose, so you kind of have a couple of different options for nonprofits. You can essentially record your PPP loan as just that, a loan. It is a loan until it's forgiven. So that would be under the debt model here. Or you can also consider that to be a government grant, because there does have that, we do have that forgiveness portion, of course, at the end of the loan period and after you spent and applied. So you can treat this as though it were a grant, and you have met the conditions of that grant. And really, the process of applying for forgiveness, if you know you've spent the dollars the way you were supposed to and you don't have any of the potential issues that we kind of touched on quickly earlier, you can say, well, just applying for the loan or the forgiveness, it's really just an administrative burden, and I've done everything else. I've earned the revenue. And so you have these two options, and it very, very much depends on your organization which one of those is going to be the best option for your organization. Some other reporting considerations related to GAAP and your footnotes and your financial statements. So there's generally, almost always, in our financial statements that we're issuing for our clients, is going to be a footnote disclosure. What are the terms? What's the interest rate? We know that's 1%. Is it a 2-year or a 5-year loan, depending on when you received your loan? It could be either of those. PPP2 is on a 5-year payback period, whereas PPP1 originally was 2. And if you took your loan after a certain point in August, I can't remember exactly what the day is, I want to say the 8th, you could have a 5-year term. What GAAP path are you choosing? Are you choosing to treat this as a loan, or are you choosing to treat this as a government grant? What's the amount that you're recognizing in income or as debt or as deferred liability or deferred revenue? Are there any risks or contingencies related to the future review and audit by the SBA? Yes, there is potentially. A note about single audit here. These are not funds that are subject to single audit. They would not or will not be included in your schedule of federal awards. And to circle back to the first item there, the available options elevate the risk of earnings management. It's a very, very good point. As I said, you have a lot of flexibility as an organization, and determining what works best for your organization and how you want to show things in your financial statements does leave open this risk of managing your earnings. And that's not necessarily a bad thing, but it's not necessarily a great thing either. So the employee retention credit is something that has been around all along, but if you had a PPP loan, you really didn't care about because you weren't eligible to take the employee retention credit. Thanks to the HRSA or CAA signed into law on December 27th, this is available now if you had a PPP loan. They've opened that up. The eligibility rules are a little different, but somewhat similar in some ways to PPP. There is a small employer versus a large employer. It gets very nuanced, and especially when you have different criteria for 2020 versus 2021. So the maximum potential credit, it says here, was $5,000 per employee per year for 2020. For 2021, now that is up to $7,000 per employee per quarter. This is only for, at this point, the first 2 quarters of 2021, quarter 1 and quarter 2. And it does increase the ability for many of you to take this credit. I'd say take, because again, it's now opened up to those with PPP loans. And some of the other criteria going forward into 2021 have made it much more, A, lucrative, as you can see, and B, much easier to obtain. So as I said, those of you who had Paycheck Protection Program loans, PPP loans, you are now able to take the retention credit. Big point here is the second bullet. You have to ensure that the wages that you're utilizing in PPP debt forgiveness are not the same wages as the retention credit. And this kind of harkens back to the double dip that many of you are concerned about as it relates to some of your Medicaid funding and other grants and funding sources in relation to PPP. Well, now we add this new layer of also retention credit. So you have to ensure that you're not using the same dollars of wages or other expense in retention credit in PPP, in provider relief funds, in your normal grants and Medicaid funding. And it becomes extremely, extremely convoluted, but it's also extremely, extremely important because you cannot be double dipping. And especially when we're talking about the strictly federal funds, these are both federal funds, PPP and retention credit. It's a very clear, very, very clear line. So up until December 31st, 2020, this was a 50% credit, again, up to $5,000 per employee, calculated based on their up to $10,000 of wages and health insurance. Moving forward, as of January 1st, 2021, it is now 70%, up to $10,000 per quarter, as I mentioned before. This applies to the wages that have been paid ever since March of 2020, up to, again, as of right now, the end of June 2021.
Hey, before you go off of that, real quick, the state itself had a lot of funding going on in the first half of last year in regards to enhanced Medicaid funding, and that ended. So when you're doing the eligibility test, right, it's against 19, even if you're in the first quarter of 21. Can you make sure you're, all right, then I'll be quiet.
I am getting there, I promise, Terry.
All right, man, that's fine.
So what is an eligible employer? And this is getting to exactly what Terry is getting to, I think. If your business, trade or business, is fully or partially suspended during a calendar quarter, that makes you eligible to take the credit. If you had a significant decline in gross receipts, and this is what Terry was alluding to, you look at 2019 versus 2020. So quarter 3 of 2020 versus quarter 3 of 2019. If you are looking at 2021 eligibility, it's a little bit different. You look at either your first quarter of 2021 versus the first quarter of 2019, or they give you the option of this previous quarter look back. So you can look at quarter 4 of 2020 versus quarter 4 of 2019, which will actually make you eligible for quarter 1 of 2021. Similarly, you can look at quarter 1 2021 versus quarter 1 2019 to be eligible for quarter 2 of 2021. And I've been advising a number of clients, if you're eligible for quarter 1 2021 by looking at that quarter versus quarter 1 2019, you actually are eligible for 2 quarters now of 2021 because you're eligible for that quarter as well as quarter 2 using that look back. I should have said at the bottom here, it does make the credit available to certain governmental employers. If you fall into that bucket, you should certainly have a conversation about the eligibility of the credit for your organization. And this gets into, and I think I just saw a chat come across related to 500 employees. So the rules again change for 2020 versus 2021. And this goes to whether you're a small employer or a large employer. If you're a small employer, you can treat all of the wages you paid and health insurance paid as going towards the credit. They're all eligible for the credit. If you are a large employer, it's only the wages for people who you paid that were not working. Or if you were furloughing individuals, for the health insurance that you were still covering for them while they're furloughed. That number has changed. For 2020, a small employer is less than 100 employees. For 2021, they shot that up to 500. So it becomes a much bigger deal in 2021 for many, many more organizations. I will say that they use the terminology of full-time employees. However, it's really an FTE test as well. And this FTE test, because of course nothing can be the same between any of these programs, is anyone that works more than 130 hours a month is considered one FTE. If you have individuals that are working on a part-time basis below 130 hours a month, you essentially aggregate all of those hours and divide by 130 to get the number of FTEs to add to the full-time FTEs that are over 130. So you could have 200 or 300 potentially employees as a head count and still have less than 100, or going forward, if you have 700 or 800 employees as a head count, you could still have less than 500 employees as it relates to this credit. So doing that math, if you think that you could be on that cusp, is very important, because again, it really opens up the ability to take the credit for many, many more dollars. Again, we also have the eligibility factor that we talked about before. You have to obviously be eligible in order to go through with all of this. So again, kind of another little cheat sheet, I guess I would call it. Kind of gives you a little bit of a very high level of what we just kind of talked about related to fully, partially suspended, the credit percentage and amounts, and related to the small employer versus large employer information. What does this mean? Let's say you now are doing this analysis and you say, hey, I could take this credit. I want to get my money. What do I have to do? Well, you're probably going to have to go back and amend some 941s from 2020. If it's going forward that you're going to be eligible, you probably don't need to amend your 941, but you have to claim it on your 941. So this is a credit against payroll taxes. This is a question we've had in the past is, well, this is a tax credit. I'm a nonprofit. I can't possibly take this tax credit. It's a credit against your payroll taxes. So absolutely every one of you that pays payroll taxes can take this credit as well. Who's going to do all of this amending and who's going to do all of this calculating? Well, that's a great question. Some of the payroll companies may be doing this. It seems as though many of the payroll companies that we're hearing about anecdotally don't seem to really have capacity, at least at this point, to be able to do that. So do you have someone internally that can run the required reports and do the required calculations? Do you reach out to a Bonadio or whatever advisor for some guidance? These are all some of the things that you're going to have to answer, obviously, for yourselves, is really, do I have the internal capacity and knowledge to do this, or do I need to reach out for some help? Especially, as it says, the double dip, New York State Clawback questions, all that. Again, we have all of these different sources of funding floating around here, and all of them have to be considered with each other as it relates to double dipping, triple dipping, quadruple dipping at this point. So again, very important to keep that in mind as you're making those decisions. PPP2 now, because we haven't talked about enough with PPP. They've opened PPP back up for PPP round 2 loans, and they caution here is just because you are eligible for PPP1 or OPPP does not necessarily mean that you're also going to be eligible for PPP2. So what is the eligibility for PPP2? First, it is basically every organization that was eligible for PPP1. However, they've made some specific exclusions, as you can see here. So likely, probably a few of these are not going to be attributable to the entities that are on the phone here, but some of them could be, especially the shuttered venue operator grant, which in itself is a quite lucrative option for those types of entities. So what about the rest of the eligibility then? You have to employ not more than 300 employees. This is a simple headcount calculation. So if you have 310 employees, whether 300 of them are part-time or not, you do not qualify to take PPP2. You do have to aggregate with your affiliates, just like you did before. Another criteria is that you have to have used or will use the full amount of your first PPP loan by the time you receive your second PPP loan. So if you did not use all of your first PPP, then you are not eligible for PPP 2. If you had taken less than you were able to take in PPP 1, you actually are going to go back and ask for what you could have taken for PPP 1 before you apply for PPP 2 as well. The last criteria for eligibility is related to gross receipts. This is a very similar item to the gross receipts test for employee retention. It's 25% reduction rather than 20% for 2021, which is related to the retention credit, or the 50% for 2020 and the retention credit. So it's 25% reduction in gross receipts from any quarter of 2020 as compared to the same quarter of 2019. You can look at it on a calendar year basis, 2019 versus 2020, but obviously you probably have to have a 25% reduction in one of those quarters to have it for the entire year. There's been much discussion about the definition of gross receipts, and the definition of gross receipts is what you see here. What would it end up in this box on your 990? So whatever ends up is gross receipts in your 990 is what is gross receipts for PPP 2. And again, that's in relation to determining the 25% reduction quarter to quarter. Loan terms are similar to what they were before for PPP 1. As far as 1%, now 5 years rather than 2 years. Maximum loan amount, it's the same calculation as it was before, 2.5 times your average monthly salary, total gross salary. You can opt to use 2019 if you're using the same lender. You can instruct them to use your 2019 data that they already have, or you can elect to use the last 12 months, which, as of right now at least, would be all of 2020. If you're in a certain industry code, you are allowed to take 3.5 times your average monthly payroll costs, but in no situation can that loan amount be greater than $2 million. They did in PPP 2, and also this relates to PPP 1, if your loan was for less than $150,000, when it comes time for forgiveness, it's a very simple, essentially one-page attestation that you sign off and provide them a couple of numbers and sign a few lines, initial a few lines saying, I did everything I was supposed to, I spent the money the way it was supposed to be spent. Some more on the forgiveness. It is the sum of all of these items. Payroll costs, and again, payroll costs includes not just your actual gross payroll, but health insurance, dental insurance, vision insurance, group life insurance, as well as the covered mortgage, rent, utility payments, and the new covered expenditures that we talked about a few minutes ago. Forgiveness period is the same, 8 to 24 weeks. It was clarified. It was sort of up in the air before if it was 8 and 24, 8 or 24, or 8 to 24. It is clearly 8 to 24. So if you only needed 12 weeks to spend your PPP dollars, then you can elect to use a 12-week period. The 60-40 split is still in effect, so you have to use at least 60% of the loan proceeds on payroll-related costs, and the other 40% you are allowed to use on non-payroll costs.
Polling question, right?
Another polling question, and I will tell you that that concludes my remarks as far as PPP, PPP2, and retention credit.
Okay. On an overall basis, my organization's financial results for calendar 20 or in the current fiscal year will reflect a surplus, deficit loss, close to break even, or I do not know yet.
While you're answering that question, I thought it might be interesting, a little statistics and trivia here, in case you're worried about people going to jail. There's been 5.5 million loans issued under PPP at this point. It's been $560 billion that's been issued. They've had 100 arrests of people that did this on a fraudulent basis, and those 100 arrests amounted to $60 million recouped. To the best of my knowledge, we have not had any non-for-profit organizations subjected to any arrests.
Since Jerry mentioned dollars, I did fail to mention that there's about $35 billion of loans that have been given out so far out of $385 billion that's been set aside for PPP2.
And for those of you who might be thinking about the alternative size standards being used for employers that may have more than 500, I did get an email this morning that said that Senator Schumer's office has spoken with the SBA on that specific topic. We still have no resolution definitively, but it's still in front of Congress, and if it is to be amended in some way or clarified, it will be done in connection with the Biden tax rescue plan. Now, on to my favorite presenter, Terry Phillips, Mr. CFO. Oh, no, you're not never one in?
I thought Margaret was your favorite person.
Well, Margaret's right up there.
Okay.
Terry's 1, Margaret's 1A.
There we go. So for those who are keeping score on winter weather and snow, it snowed 2 inches outside our window since Mr. Vollmer started talking. So just it's how complex the funding has gotten. I will say this, Mike and I and John and Jared are on the phone constantly going over the new stimulus act and how does it impact our providers. And it is very convoluted, very confusing, and it does take time and effort to figure out, and even if you're eligible. And then once you determine if you're eligible, what costs are eligible and how do we apply it and how do we report those. So if we move on, the important thing, we've had this discussion a lot. Jerry's told me to plan for a 30-minute conversation, so I set out for 30 minutes of slides. He then told me 10 minutes ago to give me 15 minutes so we could answer questions. So I will be talking more quickly than I normally do. We're now considering the interaction is what we would usually call clawback, and that's important. So how does your federal stimulus money interact with your state funding? And that's what we're referring to. The double dip, we've made that very clear in our past presentations, and we've discussed it before, and that certainly is referencing you can't use the same dollar spent for two different revenue sources. And I don't care if that's a federal or state, it is what it is. And that becomes fraudulent reporting of those things. So, and we show the potential double dips there, and it's what we didn't include here in the potential on this list is the fact that a number of you providers are getting federal awards from other HHS funds that are ongoing, or Indian Health Services or Department of Justice grants. So that also has got to be considered. Are you going to spend the money, PPP loans, to help you up in addition, or pay for other loans? But once you spend that money, you cannot be using it to report on those other awards that you received. Next slide. And again, we're going to focus on these federal awards and how they interact with on your financial reports. And everything I'm going to tell you today is important that we get the financial statements right? And certainly the statement of functional expenses right, along with functional revenue. So everything follows to set ourselves up for the CFR. And I continue to harp. The one thing that's missing here is FEMA. And FEMA we're going to discuss in more detail because it's unique in itself. Next slide. So, and here's the big item here. I love this statement. Some states, such as New York, express that they are the funder of last resort. And if you look at how the CFR is constructed, especially in deficit-funded contracts and in tuition-based contracts, they are asking for federal award money to be shown as a other source of revenue. And in those contracts and in the tuition, they use that as offsetting revenue to show the amount that they have to pay out in their cost calculation. So that's what we're referring to there, and that's an important item as well. And then the other thing that I'll mention here that's different is, is there an impact this year in our future funding? And that's at the very end. And, there's a lot of things up in the air, and we don't have a crystal ball to what will happen. We do know that there's been some decisions made that we'll talk about in regards to OMH and OASIS funds, in regards to some of the OPWD funding. So let's move on to the next item. So the big question here is, do I want to take the time to really care? All I want is the money. I want the money in the door. I want to do this. Should I take the time to really understand the interaction and concerns about the double dip? And the answer is yes. You need to understand, what will happen to your contracts. You need to understand, in your tuition-based programs or in your Medicaid-funded programs, if the Medicaid-funded program has an offsetting revenue component to it, or is it are they going to base rates on your costs incurred this year, and how do they pull those costs out? This is going to be a very difficult year, not only for you to prepare the CFRs and the Medicaid cost reports. It is also going to be very difficult for New York State to understand what took place. So they're asking for additional information that will happen. But getting that information is really critical. I think the things that we have here, some of the strategies, especially with the PPP and the employee retention credits and the provider relief funds, timing of when they expire and when you can use them compared to your other funding. We know now that OMH and OASIS are going to a 2-year funding for 2020 and 21 on their contracts. Well, how can I interact if I want to spend that money now? If I know I'm going to have a bigger spending problem or bigger issues in 21, what do I do in 20? How do all these come together to help you retain as much money as you can for your organization? What we've seen in smaller organizations is that the PPP, the deferment of taxes, FEMA, have stabilized what I would say some organizations who aren't as financially viable as others, and in essence kicking the bucket down the road maybe 24 to 36 months. So it gives you a window to correct some of those issues that you had before, but it's still there. The problems will still be there. You need to address your rates. You need to address your contracts and your staffing patterns as well. Next slide. So a little bit more on the double dip. This is, we've been, it's there. We will send these slides out, but I will say the biggest concern on this slide is risk. Okay, and risk comes in different ways. The loss of funding, loss of federal stimulus money, the loss of state funds, audits, what has happened and what happens. So again, it's worth your effort to take the time to ask the proper questions and to understand how you need to report these costs and when to report these costs. Next. And again, we're just continuing. The middle of that slide was put together by Mr. Vollmer, the shameless plug in regards to talking to him more and more. He loves to talk to people about the complexities of things. So we can note that. Next slide. Polling question.
Polling question 7. Are you comfortable with your cost allocation used in preparation of your cost reports? A, yes, B, no, C, maybe. Well, unfortunately, someone just, I can't get it.
Oh, no.
Hold on.
Okay.
Time is everything. There we go, Terry. You're on.
Okay. The first thing up is Paycheck Protection Program. Mike's already discussed the options and how to report it. The big thing for me is if you look at the bottom section of the paragraph, this is in regards to allocating the revenue to match the expenses. All right? You cannot be putting COVID-19 funds, including PPP loan forgiveness, in column 9 of CFR 2 and other income, and not worry about it when you're using the expenses of your programs that are charged to your programs and not show the offsetting revenue. That's important. So prioritizing which programs and which payroll and which expenses you should be using is important. The unique thing here is that if you ask for a loan forgiveness in 2021 against 2020 expenses, that's fine, except you have to allocate that revenue based on the expenses you used in 2020 to you, even though it was forgiven in 2021. So it's a little bit of timing difference, but you need to consider that as well. The next slide. Again, the ERCE, Employee Retention Tax Credit. This is going to be shown as grant and as grant revenue. It's going to be reported on line 79 as well. It is again, you're going to report it based on where the expenses were incurred that were used to take that credit, and that's also important. You're also going to show this along with the PPP and the other on DMH2 and on COVID-19 schedules as set forth. Continue. Next slide. That's not the slide.
No, they're not seeing it.
Okay. The self-insured for employment, for unemployment in New York State. The big issue here is related to the federal legislation. It gives you 50%, gives the providers that are self-insured 50% of their costs back. Big issues, a lot of confusion over that. The money has not been flowing to the providers. Some providers have paid all of it up front and have very large credits coming back to them in future periods. And others have paid only 50%. People were concerned about the penalties ramifications. I think the penalties, if you haven't been notified, they will go away. It is a concern. And the recommendation here is to report your expenses, all right, based on what you believe the net cost will be in the period that's incurred. So you should be recording your expenses net of the 50% reimbursement. And from the balance sheet side, you're probably going to record, if you overpaid, you're going to have like a prepaid expense and show it on your balance sheet. Next slide. Again, more of the same thing, breaking it down and following a very specific pattern. Again, that I want to point out is that it's going to be reported on line 79. It is consistent, where to spend this money. And if you're using it to replace revenue, you really need to consider which programs that are eligible for it and where you're going to put that. So it's going to be added to the COVID-19 schedules as well. And it also could be used on CFR 2, column 9, and other non-funded New York State programs. Next slide. Again, FEMA, much like PPP, you will probably not, in most cases, or in some cases, not know the total FEMA award into a future period. So your expenses were incurred in 2020. Your award might not be finalized into 2021 or 2022. For CEPA, it goes on when you get the award letter. and that should be when you should recognize the revenue on your financial statement. However, the expenses you should record when you incur them as well. And the same issues would continue where they're reported on the CFR. This next slide, a little bit of a clarification on what John had mentioned earlier. I did ask this question to New York State OPWDD, and on the 15% restoration, their response was, "We'll get back to you." So when they've been withholding 20% since July on New York State funded contracts, the budget has a restoration of 15%. The question goes, does it go back to July? Still unknown. I do not believe it's the way it's designed in the current budget, now I read it. In OPWDD, as of this morning's response to me, was they're not sure they're going to get back to us. That means the budget hasn't been finalized. They don't know the funds available. So please note that. And why that's important is, do I need to record an allowance? All right. Reduce my revenue received. How does that impact us as we go into year end? I have the same response from OPWDD as well. So I got the OMH response and OPWDD on the 15% restoration. Does it apply or does it not apply to the calendar year? On the proposed rate cuts for the residential providers, is a large cut. Ask them when we would see the rates, draft rates, and they put it out to the future. We'll get back to you as well. And the concern there is, as you go into your audits, how do I have to record a liability? Again, all this would flow through to your CFR depending on what you're going to report. More importantly, when you have a deficit-funded contract and you have to report this, your DMH2 schedules could be impacted, and DMH3 schedules could be impacted by the cut, the proposed cuts that we see here for the state-funded contracts. Next slide. Again, this goes to the ComHab for OPWDD only. The concern here, this is a big concern, is the second paragraph, is the only thing I want to mention, is that you want to make sure that you are spending the money they paid you for ComHab-R and also the ComHab retainer days. If you have more than a 5% surplus, it is subject to recoupment. It is very clear in the CFR manual, and it's very clear in my mind, if New York State needs that funding, if we do not get the federal dollars, this is one area where they can take, even though it's a Medicaid funded program, the regulations are very clear that it's subject to recoupment. So making sure that you're recognizing the proper amount of expenses is critical. All right. There are, and the CFR, continue on the CFR considerations. There are two new COVID-19 schedules. The first is COVID-19 related schedule under 33B of the CFR manual. That is strictly related for OMH, OASIS, OPWDD, DOH, and OCFS programs that you're reporting on that. And they only want to know the incremental. They want to know the increases of cost. They don't want to say decreases. So ComHab-R, from the revenue side, the retainer day billings, anything that was that they gave you additional funding, and federal dollars that you got as well. So if you've got federal dollars and you're applying federal dollars to state programs, you're going to report this on the COVID-19 schedule, and that's important. If you go to the next slide is COVID-19S, and that is really related to just the SED programs. The difference here between SED and the other agencies is SED wants to know your decreases. They know they went virtual learning as of March 18th for the remainder of the year, and what was the impact of that? A lot of organizations saw a decrease in transportation or food costs or aids. They laid aids off, and they continue to get revenue, tuition-based revenue at the same pace they were getting. The issue here then goes, should you be recognizing a reduction in revenue based on your estimate of New York State said reconciliation process. So that is a very good question. I would say yes, because you're not going to be able to keep that money. That's the tuition-based reconciliation process is very convoluted, not timely, but you should not be showing a large surplus in your programs if you think that you're going to have to pay that back. Next slide. These are just additional expenses and revenues that the next two slides that are there just gives you some ideas that's out there. And next polling question.
Last polling question. Who will be MVP of the Super Bowl? Tom Brady, Patrick Mahomes, or the rest of the field? All right, so we have approximately 10 minutes left, and I've been tracking the questions that have been coming in. Mike, I'll start with you, seeing we have a lot of questions. Let's try to keep responses to about 60 seconds. If you did not take ERC because you thought you were prevented due to PPP, what are the options for you? I saw this question come in a couple of times.
So the obvious answer is the option is there to take ERC now. The harder question is how do you kind of allocate between all of the different things? If you just take PPP and ERC, you can't, again, use those same salaries. So it's going to be a detailed analysis of what salaries did I use for what, during what period was I eligible to use those salaries for all of those different things. So it's a easy answer of you can get it. It's a hard answer of how.
All right. Are the provider relief funds subject to a single audit? Yes, they are. The single audit threshold is $750,000. We've talked about in previous webinars. Even if you didn't receive $750, remember it's in the aggregate. So any other federal dollars you might have received, you got to add it to that total. Along those lines, Margaret, do all of HHS payments have to be reported on, no matter how small?
Yeah, they do. The only if you receive 10,000 or less in total, you're not subject to the reporting requirements, but you do need to keep track of those funds in terms of double dipping and in terms of all the other things that we've talked about today.
Oh, Mike, a question back for you. This is one I like to text you at night about. For employee retention credit, can you qualify as eligible based on specific program or division, or is it total receipts or total closures? Also think about, we probably have essential employers listening in right now.
So you can qualify, if you're qualifying by gross receipts, it's on an organization-wide basis, including affiliates. If you're qualifying based on, or eligible based on full or partial shutdown, a partial shutdown could be a specific division that could make you eligible. There is essential employers, as John mentioned, that you have to be able to indicate that your shutdown is more than nominal to your business. And they, of course, don't define what nominal means. So there is some, certainly is open to some interpretation on what nominal is.
All right. Terry and Mike might have to piggyback on this, but it came in when Terry was talking. In May 2020, received the PPP loan. We documented our economic uncertainty. So we obtained the PPP loan. We incurred the expenditures. We have the forgiveness is in July 2021. Why would we take that cost and shift it back into the 2020 fiscal year? Because I think maybe the question meant, Terry, when you said, well, you would allocate the revenue you received in 2021 back to 2021 programs. So there might need to be a clarification because they were saying weren't the costs incurred in 20?
Yeah, so let me try to articulate this. If you did not record the revenue on your general ledger, CFR follows generally accepted accounting principles. So if you're going to recognize that revenue in 2021, that's fine. However, when you report that revenue, you need to put it in the programs where the costs were incurred, right, that were used to forgive that loan. So even though it's 2021 when you report the revenue, you would use the 2020 program expenses to allocate that share, that revenue.
Okay.
That's what I was saying.
All right.
And I just want to say real quick, we did get notified just when we're in the meeting that OPWDD and DOH have delayed the implementation of the proposed rate cuts that were supposed to be effective on 10/1 to 5/1. So that is very good news because it was a significant amount of money, and that was discussed this morning. And actually, they just released it at about 1 o'clock this afternoon. The other issue that I missed, and there are some people who were on this conversation with me, was that OPWDD would like to have you report they have revenue and expenses to your best ability where the individual is enrolled in their program. So the difference was the question between site-based and day have without walls, and they are now saying if the person was at a site-based program, you should be reporting that at its original site where they're enrolled at, along with the expenses.
So Terry, that's a big deal, 10/1 to 5/1 deferral, and I believe now we should be introducing breaking news from Terry Phillips, also known as Wolf Blitzer, from CNN. Go ahead.
We get our own music.
No,
we could have a streaming thing across the top of the webinar.
That's great news. Yeah, I think it's great news. It's a big savings, especially moving it out. It also tells you what the state is thinking as well from a budget perspective.
We're not planning on doubling the cuts or anything like that.
I did not see that. No.
Okay, go ahead.
All right, another one of my favorite questions. Margaret, can HHS funds that were received in 2020 be deferred into 2021?
Yes. You have until June 30th of 2021 to use the funds, and there will be a final reporting on the use of those 2021 funds in July of next year.
All right. Mike, our slide 50 states PPP funds are not subject to a single audit, but it was just stated in a Q&A they are subject to a single audit. Can you clarify?
Yes, so PPP funds are not subject to single audit. Provider relief funds are subject to single audit, and I thought that's what I heard, but maybe we got a few P's mixed up here.
How about ERC?
ERC is not specifically listed as being subject to CFA.
So PPP no, PRF yes, ERC no, but.
FEMA
Correct.
yes, if and when you ever get FEMA.
Okay, Jerry, a couple questions for you. With respect to possible restoration of funding withholds on the state level, we identified a possible 15% and a 5% restoration scenario. Where are we getting that information from? And with the state moving into their next budget year, is it obviously, in your expert opinion, is it less likely to be restored if the state approves the new year budget for the past period voucher withholds that fall outside this new budget year?
I'm going to pass that one to Terry Phillips because he's my favorite presenter.
Well, I was responding to
and he wasn't listening.
All right.
Ask it again, because I don't know the answer to that question. In my expert opinion, I would say that you can plan on the worst possible answer from the state if Cuomo doesn't get his $15 billion. Go ahead, Terry.
What's the question?
The question is, we've laid out today talking about two budget scenarios with the state. The worst case, fair funding. So either that could result in a restoration of the 20% withholding to at least 15%, so that's a 5% budget cut, or it could be nothing. Is it less likely to be restored if the state approves this new year budget period before the past period voucher withholds all the fall outside this new budget year?
I'm going to take a more I would say not a conservative role. I would take the most likely, which is we now understand based on what the executive budget is, I would be basing my 2021 based on the information that's in there, and not what I would call the doomsday approach. If we don't get the $15 billion, I think there has been some backroom understanding, and I think what's still out there is I don't think I'd go back to the full restoration, the additional 5, but I would definitely use the 15% and plan it that way.
All right, Jerry, is there more information regarding the impact on community mental health providers in New York State in relation to the OMIG recoupment and managed care requirements?
So the provider associations are all over this issue of these OPRA audits that have identified recoupments at 32 different mental health providers around the state. I think the highest one that we've heard about is 1.7 million recoupment, but they're in not thousands of dollars, but tens of thousands and hundreds of thousands. So the short answer to the question, and I think I said this earlier, is that if the provider associations cannot get response from the legislators related to pushing back on OMIG through the individual entities of OMH, OASIS, et cetera, then I believe that there's going to have to be some form of a class action litigation on behalf of mental health providers that's going to ask for an injunction against OMIG with respect to recoupment of these funds. It's very, very messy. We've talked to a number of our different law firms that we work with, and they are watching it very closely to see just what OMIG is intending to do with respect to deferral of the recoupments while they assess whether or not this technical violation that they have identified with respect to eMedNI and the various software that is used for purposes of processing claims. Until that gets resolved, I am cautiously optimistic that logic will prevail and that we will not have behavioral health community-based providers having to shut down because they can't make payroll to pay their clinicians in the midst of opioid epidemic and mental health dramatic increases in community need.
Okay. At 1:32, the last question will be one of your favorite topics, Jerry, is do you think with the need to access resources and what we've been talking about related to the uncertainty in the state budget, what you just discussed as well, this will cause more agencies to consider their long-term viability and consider mergers and affiliations?
It's becoming increasingly clear, not published, but as many of you know, CDPAP and CDPAS back in February of last year was subject to a RFQ, RFA for purposes of the 700 CDPAP and CDPAS providers. Depending upon who you talk to at the Department of Health or at the state, they said they wanted to reduce it to 100 or maybe as low as 50. And I believe that that's a precursor of what is going to happen as the state continues to have difficulty in oversight over the thousands of providers that they've contracted with, and I might add that they have instilled to be created over the last 50 years. We are now going through what will be a forced Amazonification of the nonprofit human service sector. Whether or not it's going to be consistent across OASIS and OMH, I am concerned about the creation of the Office of Behavioral Health and what that might mean for OMH OASIS providers on a going forward basis. It's very clear that OPWDD has said for the better part of 15 years that there are more providers, and particularly those that are now in the crosshairs that have administrative cost percentage above 15%. And again, I understand that the statistic in New York City Metro for providers above 15% administrative costs is something of concern. And it won't be long before that elimination of all costs above 15% in the OPW arena will contribute to further, if you will, consolidation, Walmarting, Amazonification, whatever you want to call it, over the course of the next 3 to 5 years. I believe once we get through the pandemic, the last 6 months or the last 3 months of this year and into 2022 will be the high watermark for providers to consider whether or not they have the ability to maintain sustainability and viability as an autonomous organization on a long-term basis.
Okay. 135.
Thank you all for participating in today's program. We will get the slide deck out to you as soon as possible. Questions will be answered in writing. That takes a little bit more time. I will say that when Mike Bolmer was talking and 2 inches of snow, when Terry started talking, the snow went away immediately. So thank you all. Stay safe and healthy out there, and thank you for participating. Next one will be March 5th, and we'll get an invite out probably early February once we know a little bit more about Congress's actions on the Biden recovery proposal. Have a good day, everyone.
Thank you all.